Hi, good evening, everyone. So, welcome to this PYQ session series. Today, we will be having a radiology session, and your anatomy session will be on based on PYQs will be conducted tomorrow. Dr. Ashwani had um, some urgent work, because of which we have switched the session, and today we will be having a radiology session, and tomorrow you will be having the anatomy session for the PYQ. All right, so I hope you people are doing well. I will not be taking much of your time. What I have done is that I have accumulated the PYQs of NEET from 2019 to 2023. So that means 19, 20, 21, 22, and 23. There are around 80 questions that I will be discussing with you. And I will not be going too much into the theory part of it. Rather, I will be discussing these questions, and I will try to discuss what are the associated questions that can be asked in the NEET PG exam in the time to come. When I was collecting the question from 19 to 23, I have realized that every year almost one or two questions are direct repeat that are coming, and on an average 2 or 3 questions are improvised questions that are coming. So that means if you're gonna spend next 1 hour to 1.5 hours with me, you will be seeing, if not more than that, at least direct to repeat from this particular session, and at least 2 to 3 or 4 improvised questions from this, and that is how I feel it should be. I am sharing this PDF with you on the DBMCI Telegram group. So I have already shared it on my Telegram channel at Rajat's Radiology Review, and I have now shared it with the DBMCI Premier group also. So if you are a DBMCI student, you can get it. Is there another way to share it with you? Please let me know. I would be happy to share the PDF with you, right? So let us start the session. All right. Okay. So a mid-age male presented with acute onset pain in the right limb, and investigation was performed. What is the name of the investigation? So this is a standard way that they have started asking the question. We all know what is the name of the investigation. What is this? So this is a very simple question. Answer is ultrasound Doppler. So this question, when it was asked in NEET PG 2022, this was बच्चे जो सेशन हो रहा है पहले उसको कर लेते हैं. I do not know the date of the surgery session, but anatomy session was supposed to be conducted today, but Dr. Ashwani had some urgent work, and it will be conducted tomorrow. And tomorrow you will be having your anatomy session, right? Okay, but now let's focus on to the thing that is already there in our plate. So let's utilize this. Now, in the future exam, please expect much bigger question than this. Now, examiner will ask you what is the name of this pattern. So this is called as triphasic pattern of Doppler. Remember that, eh? Triphasic pattern. And triphasic pattern is a normal pattern for which vessel? Triphasic pattern is a normal pattern for a peripheral artery. Okay, peripheral artery. What are the examples of peripheral artery? Femoral artery, radial artery, any artery that is supplying the upper and lower limb is a peripheral artery. Now, who will tell me? Can you write it in the comment section? What is a pattern seen in visceral artery? What is the name of the pattern that is seen in the visceral artery? Yes. Yes, the answer is correct. Monophasic pattern with pulsation. The pattern seen in a visceral artery, be it a umbilical artery, be it a uterine artery, is a monophasic pattern with pulsation. Okay. All right. बच्चे I will be having another session for FMG, but FMG, please attend this particular session. It will be useful for you because it's just a PYQs, and now a lot of questions are common between NEET and the FMG exam. Name the investigation shown. What do we see? It's again a very simple image. The answer is PET plus CT, and a PET plus CT is PET CT, right? PET plus CT is PET CT. Please remember, it's a bicolor image. Yellow color will represent higher activity, red color will represent lower activity. What is the utility of the PET? PET is the most useful imaging investigation for staging of all the cancers in the body. Most useful imaging investigation for staging of all the cancers in the body presently is PET-CT. Now, let's quickly revise some more question. Anybody who can quickly tell me which cancer does not show activity on PET scan? Which cancer does not show activity on PET scan? What is the answer? Typical carcinoid. And a typical carcinoid and bronchoalveolar cancer. Typical carcinoid and bronchoalveolar cancer, they do not show any activity on PET scan. Which blood test should be done before performing FDG PET? Which blood test should be done before performing FDG PET? What is the answer? The answer is RBS, which should be less than 200 milligram per deciliter. And it should be less than 200 milligram per deciliter. Alright. So contrast. Question number 3. Which of the following, NEET PG 2019, this question was asked. Which of the following is a water soluble contrast? Please remember, all compound of the iodine are water soluble. Be it an ionic dye, be it a non-ionic dye. All compounds of iodine are water soluble. What are the example of ionic dye? Gastrographin, urographin. Gastrographin and urographin are the example of ionic dye. What are the examples of non-ionic dye? Iohexol. Iohexol is an example of non-ionic dye. Anybody who remember which blood test should be done before an iodinated dye? Which blood test should be done before an iodinated dye? Answer is KFT. KFT, whether it is ionic or whether it is non-ionic, KFT should be done before giving an iodinated dye, right? Alright. Question number 4. Again, NEET PG 2020. Recall, which sign is seen on USG when the femoral vein meets the great saphenous vein and the femoral artery at the saphenofemoral junction? So you have got a common femoral vein like this. You have got a femoral artery here, and you have got a great saphenous vein draining into the femoral vein. Okay. In spite of having a bad drawing, I think still you can identify what is the name of this sign. This is called a Mickey Mouse sign. Okay. Mickey Mouse sign is seen at a saphenofemoral junction. Question number 5. Personal dose monitoring is done by, what is your answer? TLD batch. What is TLD? Thermoluminescent dosimeter. Thermoluminescent dosimeter is used for personal dose monitoring. Very, very quick question. Anybody who can tell me how frequently this should be checked? How frequently this should be checked? Answer, every 3 monthly. Every 3 monthly this should be checked. Okay. And what is the guideline for an occupational worker? Guideline for an occupational worker is this value should be less than 100 millisievert in 5-year period. It should be less than 100 millisievert in a 5-year period. But what about pregnant occupational worker? For a pregnant occupational worker, it should be less than 2 millisievert for the declared term of pregnancy. It should be less than 2 millisievert for the declared term of pregnancy. Okay. Very interesting question. Which of the following is the true statement in relation to the radiation sensitivity of the tissue? Radiation sensitivity. Rapidly dividing cells are resistant to radiation. Please remember, this is wrong. This is wrong. What does law of Bergoni says? More dividing is the cell, more sensitive is the cell. GI mucosa is the one of the most radioresistant tissue. No, that is also wrong. The dose of radiation is inversely proportional to the square of the distance from the source. Yes, that is correct. That is correct. And this is what is called as inverse square law. Inverse square law. Intensity of the radiation will decrease by square of the distance as it increases. Small vessels are resistant. No, small vessels are very sensitive to radiation. And this is called as endarthritis. And arthritis, and that is what happens. Now please see this. This question which is asked in 2020, let me see. it is again, I have a question. It is again repeated in 2023. So exactly same question was repeated in 2023 and the answer will be same. So the point to be noted is that whatever PYQs that we are doing, expect one or two will be a completely direct repeat with the same choices. A lot of them will be improvised, but two will be direct repeat with the same choices. All right. Question number 7. I'm waiting for an answer for this. Remote after loading is used in. Remote after loading is used in NEET PG 2020. This was asked. Answer is brachytherapy. Now, brachytherapy, when the radioactive source is placed inside the body, in order to place it, remote after loading is used, so that the person who is putting up the radiation devices, I mean all these pins and needles, they are spared from the radiation. Remote after loading device is used in brachytherapy. Okay. Electron beam is used for superficial therapies. It is used for superficial therapies like intraoperative radiotherapy or cutaneous T-cell lymphoma. Proton beam kills the deep cell without damaging the normal tissue. Kills the deep cell without damaging the normal surrounding tissue. And proton beam utilizes Bragg's peak concept. It utilizes Bragg's peak concept. Okay. Question number 8. A worker who was working with hammer and chisel while was trying to break a hard stone, admitted to the hospital after injury to the eye. Which among the following investigation done would be detrimental? What have we read? Chisel and hammer injury. Chisel and hammer injury, immediately what is contraindicated? MRI is contraindicated. And MRI should not be done because an iron particle might be present inside the eye and it can cause perforation of the eye. Patient may turn blind, right? Very important. Question number 9. A child is suffering from acute lymphoblastic leukemia. He has undergone prophylactic cranial radiation for the same while waiting for bone marrow transplant. Which of the following will be least affected by the radiation exposure? Which is the most radio resistant cell? More differentiated, more resistant. Answer is neurons in the brain. Neurons. Now this also tells you prophylactic cranial radiation are done for ALL. Prophylactic cranial radiations are also done for small cell cancer of lung. Small cell cancer of the lung. Prophylactic cranial radiations can be done. Okay, so neurons in the brain are least affected by the radiation exposure. Okay, 10th we have already done. Okay, now let us look at some questions where they commonly ask anatomy on a radiological section. NEET PG 2019, they asked such a simple question. Identify the marked structure. What is this marked structure? This is cerebellum, right? Cerebellum. They might ask you this structure also. What is this structure? This is fourth ventricle. This is fourth ventricle. This structure is what? This is midbrain. What is this? This is pons. What is this? This is medulla. Alright. So what is the answer? Identify the marked structure in the figure. Answer is cerebellum. Cerebellum. Right? Identify the marked structure in this figure. Okay. Arrow is not pointing properly. This should have been the place of the arrow. So these are two lateral ventricles. There is a septum pellucidum that is dividing the two, and the two thread-like structures that are coming from them are nothing but fornix. Alright, and they're gonna go posterior inferiorly and culminate into the mammillary body. Anatomy on a radiological section is a standard part of the paper. If you have not done this, quickly go through your transfer section once and please make sure that you are getting this correct in the paper. Now this is another way of asking the question. 2021 they asked this question. See this. A child was brought to the hospital by his father with complaints of fever, low backache and persistent flexion of the hip joint. He had a history of spine TB in the past. what is the examiner trying to tell you? Spine TB था, अब persistent flexion of the hip joint है, इसका मतलब है क्या? What is happening? Psoas abscess is happening. On examination, child has inguinal swelling, यानी कि further increases. On examination, identify the marked muscle responsible to be involved. So this muscle that you could see is the psoas major muscle. Psoas major muscle. A very important message that I want to give you is, please make sure in such kind of question they are marked A, B, C, D. So this question is simple. Sometimes they play with you 1, 2, 3, 4. They give the choices as B, C, A, D. And please make sure then you are putting up the right answer. Okay. Please do the paper with clear, open mind and open brain. Okay. Don't do this blunder in the paper. Question number 14. A 65-year-old diabetic and hypertensive patient presented with hemiparesis. CT image was shown in the figure. What is the diagnosis? If you are seeing hypodensity on CT, it is ischemia. If you are seeing a white area on the CT, okay, if you are seeing a white area on the CT, then it will be hemorrhage. If you are seeing a black or a hypodensity, it is ischemia. It is ischemia. If you are seeing a white area, then it is hemorrhage. Okay. Now this is a very interesting question. I will wait for an answer from you. CT head in the figure is showing what? CT head in this figure is showing what? Okay, if you are thinking this as the intraventricular bleed, no, please remember, no, this is not. This is choroid plexus calcification, which is normal. If you are seeing this as abnormality, no, this is the pineal gland calcification, which is also normal. This is also normal. Then what do you see? See this image. You are seeing a subtle small hypodensity in the region of left basal ganglia. When they are typically hypodensity is less than 1.5 centimeter in size, these are called as lacunar infarct. These are called as lacunar infarct. All right. So this is an image of a lacunar infarct. Basal ganglia bleed will be seen white in color. Now who will tell me where will you see watershed infarct? Where will you see watershed infarct? Watershed infarct will be seen at the junction of two arteries. So that means between ACA and MCA, between MCA and PCA. These are called as territorial infarct, secondary to global hypoperfusion. Secondary to a territorial infarct, global hypoperfusion. Right? Now let us see this. A 45-year-old female with sudden onset headache and neck rigidity. So please remember, neck rigidity देखते ही क्या मार्क नहीं करना? Neck rigidity देखते ही क्या मार्क नहीं करना? Meningitis मार्क नहीं करना. Neck rigidity with fever is meningitis. Without fever is subarachnoid hemorrhage. With fever is meningitis. Without fever is subarachnoid hemorrhage. And you can typically see blood in CSF. Blood in CSF and typically what is called as a star-shaped hemorrhage. So this is a case of subarachnoid hemorrhage. They see blood in sylvian fissure, blood in the perimesencephalic cistern, basal cistern. So this is a subarachnoid hemorrhage. ठीक है, याद रखना है. Alright. Question number 17. Cystic lesion in the suprasellar region with calcification. Remember some salient features of the tumor. Suprasellar lesion with calcification. There is only one answer. There is only one answer. What is that? Craniopharyngioma. Craniopharyngioma. Figure of 8 appearance in sellar and suprasellar region. Pituitary adenoma. Intraparenchymal lesion with calcification is oligodendroglioma. Intraparenchymal lesion with calcification is oligodendroglioma. All right. Okay. Question number 18. A 12-year-old child with a history of fever, headache and chronic ear discharge underwent a CT scan of the brain as shown below, what is your likely diagnosis? So please see this. What do you see? You are seeing a well-defined intraparenchymal lesion. Okay, and the patient has fever. The lesion is black from the center, white from the periphery. So that's a classical, very, very classical image of an abscess. Very, very classical image for an abscess, and it is present in the temporal lobe. So this will be temporal lobe abscess. Temporal lobe abscess because of the chronic ear discharge. The patient is having a temporal lobe abscess, right? Question number 19. A patient presented with loss of vision of the lateral side. MRI image shows an aneurysm compressing the optic chiasma. Optic chiasma कहाँ होता है? Optic chiasma midline में होता है, right? And if there is a compression of the optic chiasma, the aneurysm has to be present in the midline. Aneurysm has to be present in the midline. You have got two internal carotid arteries, two middle cerebral arteries, two anterior cerebral arteries. You have got two vertebral arteries which are joined to form basilar artery, and you've got two posterior cerebral arteries, and these are joined by posterior communicating artery. None of the bilateral vessels can be in the midline. You have one vessel which is joining the two anterior cerebral artery, and this is anterior communicating artery, and this is an ACOM aneurysm. If it is compressing the optic chiasma, there should be an anterior communicating artery aneurysm, right? Question number 20. Question number 20 was NEET PG 23 question. I hope you already have done it very, very well. A 50-year-old patient with a history of trauma 1 week back. है ना? 1 week old trauma है. What have we learned? EDH कैसा होता है? Acute होता है. SDH कैसा होता है? Acute भी हो सकता है, सब acute भी हो सकता है, और chronic भी हो सकता है. The history of trauma 1 week back, it should made you think twice that this should not be an EDH. This should not be an EDH. Now, what are we seeing? This is the skull, and this is the hemorrhage, and this is the hemorrhage. Okay, though broadly it looks like a biconvex, but this is not a biconvex. This is actually a slightly crescent shape hemorrhage, but more important than that was the history of trauma 1 week back. So this is a case of subdural hemorrhage. This is a case of subdural hemorrhage. Subdural hemorrhage. Okay. 21. Which of the following is the most likely to be seen due to rupture of saccular aneurysm in the brain? Please remember, any aneurysm in the circle of Willis, if this is ruptured, it will lead to subarachnoid hemorrhage. Image of trauma, image of a brain hemorrhage is usually a part of the paper. Usually a part of a paper. Please remember, not hypertension. Hypertension will lead to intraparenchymal hemorrhage. It will lead to intraparenchymal hemorrhage, right? Question number 22. A 30-year-old female delivered a 1 kilogram baby at 31 weeks of gestation. Child has hepatosplenomegaly and jaundice. On CT scan, periventricular calcification is seen. CP में DT सिनेमा हॉल है. CP में DT सिनेमा हॉल है. C for CMV, P for periventricular. C for CMV, P for periventricular, D for diffuse, T for toxoplasmosis. D for diffuse, T for toxoplasmosis. So what is the correct answer? The correct answer is CMV. Cytomegaloviral infection. CMV. 23. A 30-year-old presented with altered sensorium, CT revealed bitemporal hemorrhage. Bitemporal involvement is a diagnostic feature of herpes. Please remember, if you see bilateral thalamic involvement on CT or MRI, your answer will be JE. If you see bilateral temporal lobe involvement, then your the answer will be herpes, right? 24. A patient presented with history of diplopia and restricted eye movement. A clinical image, I am not showing you clinical image, and a CT image is given. What is your diagnosis? What do we see? This is the right orbit, right? And this is the left orbit. There is a fracture of the left inferior wall and the orbital contents are herniating into the left maxillary sinus. The name given to this is called as tear drop sign. Tear drop sign, and tear drop sign is a feature of blowout fracture. Tear drop sign is a feature of blowout fracture. 25. An NCCT of the paranasal sinuses was shown in the image. What is the name of the sign shown? What do we see? You are seeing hyperdense content. You are seeing hypodense content within the sinus. So hyperdense content and hypodense content, if both are seen within the sinus, what is your name? This is called as double density sign. And double density sign is a feature of allergic fungal sinusitis. Allergic fungal sinusitis. 26. Occipitomental view with open mouth best describe which X-ray? Occipitomental view is when maxillary sinus is seen. When it is with open mouth, this is called as Pierce view. When it is with closed mouth, I will like to call it as a Waters view. Then I will call it as a Waters view. So that is question number 26. Okay. 27. A 45-year-old patient complains of recurrent swelling in one side of the neck. She is afraid of eating food as it worsens the swelling. Imaging was performed and shown below. Now what do you see? I hope this is very easy for everyone to identify that this is mandible, right? And you are seeing this white area. What have we learned in the classes? If it is white on X-ray, either it is bone or stone. This is not bone, then it has to be stone. If it is in lumen, it is calculus. If it is in the tissue, it is calcification. So this is in the duct of the salivary gland, and this is a case of cyalolithiasis. Right? A very, very standard question that is very frequently asked in the exam. What is the diagnosis? You can see straightforward, steeple sign. And steeple sign is a feature of ALTB, acute laryngotracheobronchitis. Steeple sign is a feature of acute laryngotracheobronchitis. Okay. So see, this question was asked in NEET PG 2020, and see, same was repeated in 2023. All right. Same question, nearly same choices. 29. A 30-year-old female presented with non-axial proptosis of the left eye since last 3 years. There is a history of trauma to the eye 10 years back. See, everything that is given in the question has a reason. The imaging revealed homogeneous lesion in the left frontal sinus. Now they are giving the lesion in the left frontal sinus. Even if you do not know what is the lesion, please remember, this cannot be a meningioma. This cannot be a juvenile nasopharyngeal angiofibroma. This cannot be a pseudotumor, because none of them can be present in the frontal sinus which is associated with trauma. So the only answer that comes to my mind is a frontal mucocele. Right? 30. A 5-year-old child felt difficulty in swallowing when he was playing alone unattended by the mother. A 3 to 5-year-old child develop respiratory distress while playing. That means he has ingested something. Now this foreign body is likely to be present either in esophagus or in trachea. If it is flatly seen on the frontal view, it is present in esophagus. If it is seen as a slit on a frontal view, it is present in trachea. So this is the foreign body in esophagus. Right? 31. A chest X-ray of a patient with low-grade fever is shown in figure. What is your diagnosis? What do we see? In this chest X-ray, we are seeing multiple tiny nodules scattered in bilateral lung. Multiple tiny nodules scattered in bilateral lung, which are typically less than 5 mm in size. These represent miliary nodules. These represent miliary nodules, and if there is a miliary nodule, this is a feature of biliary TB. Now, low-grade fever miliary nodule, always think of biliary TB. Question number 32. A patient came to emergency department with some complaints and radiographs shown in the figure. What is the definitive treatment? 2 seconds and answer. What do we see? Air under right dome of diaphragm. Air under right dome of diaphragm means pneumoperitoneum. With pneumoperitoneum. And if there is a pneumoperitoneum, it is secondary to a hollow viscous perforation. And if there is a hollow viscous perforation, I would like to do a laparotomy. And then I would like to do a laparotomy. A patient who is a known case of acute pancreatitis developed breathlessness. Bilateral basal creps on day 4 and chest radiograph was shown. What do you see? What do you see? See, history is telling you everything. Acute pancreatitis patient now develop breathlessness and crepitations. Now what do you see? It cannot be anything else but ARDS. And acute respiratory distress syndrome. And you can see multiple fluffy opacities scattered in bilateral lung parenchyma with an appropriate clinical history. That's a classical case of ARDS, right? Very simple question, NEET PG 2019. Boot-shaped heart is due to. So boot-shaped heart is seen in tetralogy of Fellow. What are the 4 components of the tetralogy of Fellow? You know, pulmonary stenosis, right ventricular hypertrophy, overriding of aorta, and ventricular septal defect. Out of this, which is leading to boot-shaped heart? Right ventricular hypertrophy. Right ventricular hypertrophy, right? This is an interesting question. Which heart chamber enlargement can be seen on barium swallow in a patient with mitral stenosis? So what is happening? This is heart. Alright, this is the heart. This is right atrium. This is right ventricle. This is left ventricle. This is left atrium. There is a stenosis of air. So which chamber will be enlarged? This chamber will be enlarged automatically. There is a back pulling and there is a left atrial enlargement. Who will tell me what is the earliest feature of the left atrial enlargement? Earliest feature of the left atrial enlargement is the posterior displacement of esophagus. Posterior displacement of esophagus, but this will be seen on barium swallow. On barium swallow, what is the earliest feature on a chest X-ray? Earliest feature on a chest X-ray, straightening of left heart border if given in the choice. Straightening of left heart border. If straightening of left heart border is not given, then elevation of left main stem bronchus. Straightening of left heart border if given in the choice. If not given, then elevation of left main stem bronchus. Question number 36. A female patient presents with shortness of the breath and bilateral basal rails. Her chest X-ray shows reticular opacities in the bilateral basal field. So, the shortness of the breath with reticular opacity. Reticular opacities on the chest X-ray is a sign of ILD. Is a sign of ILD. Image of the hand is shown. Okay? Now, image you know from your dermat, but it's an ILD with possibly a systemic sclerosis. I would like to go for an HRCT. I would like to go for an HRCT, high resolution CT scan, to quantify the degree of interstitial lung disease. Okay. 37. A 20-year-old man with hypertension has following chest X-ray finding with the prominent aortic knuckle. So the image is not very great, but please, I think you can easily see this reverse 3 sign. The image is not projecting very well, but you could have seen some scalloping of the inferior rib margin. along with the hypertension in a young patient, always think of coarctation of aorta. Coarctation of aorta is a very standard question that the examiner asks, and usually what is happening is that there is a collateral between the anterior and the posterior intercostal arteries that are being formed, and that leads to the rib notching, right? Shape of the heart is a common question that you get in the exam. We just saw the theory part of that, and now in 19 it was theoretical, in 20 it was an image based. That's a classical boot shaped heart which is seen in top. If you ever confuse it with egg on a string appearance of TGA, please remember, look at the age if it is given. TGA usually present between 1 to 5 days, and TOF usually present between 5 to 12 months. Okay, then you can also see lung vascularity. Pulmonary oligemia is a feature of TOF. Pulmonary plethora is a feature of TGA. Okay, pulmonary plethora is a feature of TGA, right? 39. A 12-year-old child was admitted to the hospital with fever. A chest radiograph was given below. What is the correct match? Now, what do you see? Shape of the heart, as I told you. See, 3 questions I could see. What is this called as? Figure of 8 appearance. Snowman shape heart in total anomalous pulmonary venous connection. Total anomalous pulmonary venous connection, right? Question number 40. A 63-year-old hypertensive patient presented with chest pain and diaphoresis. History is always extremely important. Hypertensive patient, chest pain and diaphoresis. On examination, he has unequal pulse in both the arm. What have we read in the classes? If there is a chest pain with unequal pulse, there is only one disease that should come to your mind, and that disease is aortic dissection, not acute MI. The disease that should come to your mind is aortic dissection. Aortic dissection. Now, which of the following is the most useful imaging investigation in emergency in this case? So, acute aortic dissection, if the patient is stable, I would like to go for a CT angiography. However, the patient is unstable and I want to do an emergency investigation. Answer is TEE. Transesophageal echocardiography. Transesophageal echocardiography, right? 41. 22 question. NEET PG 22. A 35-year-old female presented with fever, expectoration and difficulty breathing. HRCT of the chest was performed and shown. What is your diagnosis? What do you see? Area of hyperdensity, right? Area of hyperdensity. Always remember, if the area of hyperdensity is obscuring the blood vessel, it is consolidation. If it is not obscuring the blood vessel, it is ground glass appearance. If it is obscuring the blood vessel, then it is consolidation. Not obscuring the blood vessel, then it is ground glass appearance. And in this case, you are seeing the blood vessels? Answer is no. Blood vessel has to be whiter. If it is black, it is air. If it is black, it is air. And this is air bronchogram sign. Air bronchogram sign. So this is a case of consolidation with air bronchogram sign. Consolidation with air bronchogram sign. Shall I tell you a catch here? This is a lung window. If it's a lung window, lung pathology will be shown to you. If the examiner wanted to give you pleural effusion, mediastinal window will be given. If the examiner wanted to ask you mediastinal mass, mediastinal window will be given. So, lung window should show you a lung pathology, right? Question number 42. A 30-year-old patient presented to the casualty after a motor vehicle accident. He has bruises on the chest. His pulse is 120 beats per minute. BP is 90-60. Respiratory rate is 40. A chest X-ray was performed and shown below. What is the next most appropriate step in the management of this patient? Most appropriate step in the management of this patient. Now, what do we see? What are we seeing? We are seeing. What are we seeing? We are seeing pneumothorax. pneumothorax. And this is a case of tension pneumothorax. This is a case of tension pneumothorax. Okay. So now depends. Now needle thoracotomy is the best way to do this particular case. Okay. So you have to see the language. If it's an open thoracotomy is given, then that will not be the answer. But if needle thoracotomy is given, then that will be the answer for the case. However, if a surgical thoracotomy is given, then out of these four options, the best answer will be chest tube placement and drainage, because a chest tube placement can also be done to permanently drain the pneumothorax. So you have to see the exact language, and according to that you have to pick up the answer. But this is a case of tension pneumothorax. 43, again same question, again repeated. You are seeing what? Severe abdominal pain and vomiting. Vitals are stable. Most effective way to treat the patient: air under right dome of diaphragm. And if you see air under right dome of diaphragm, exploratory laparotomy is the next step in the management of the patient. So see, even in this 5 years, you are seeing direct repeat that are happening. I have just collected the question from 19, 20, 21, 22 and 23, and you are seeing so many direct repeats that are happening. 44. A 25-year-old patient presented with fever, dry cough, breathlessness and night sweats. On chest x-ray, bilateral hilar lymphadenopathy was seen. In fact, in this case, there is additional history that was given. Additional history, I still remember this question from NEET PG 2022. There was facial nerve weakness and bilateral facial swelling, which was also given in the question. Facial nerve weakness and bilateral facial swelling was also given in the question. Now, which was making it the diagnosis of Hereford syndrome. Hereford syndrome, and Hereford syndrome is seen in sarcoidosis. Even then, वैसे भी the rule says bilateral hilar lymphadenopathy in an MCQ exam is a feature of sarcoidosis. Okay. Now 45. 45 is a typical question that is expected nowadays, which is more of medicine question but solved on the basis of the radiology knowledge. A 65-year-old hypertensive on multi-drug treatment with poor compliance presented with sudden onset breathlessness. That means the examiner has told you that this patient is not taking treatment of the hypertension in spite of being on the multi-drug. That means there is a disease which is related to the hypertensive crisis. A chest x-ray is done and shown below. Now, what do we see in a chest x-ray? A classical bat wing appearance. That means a classical pulmonary edema. So that means it is acute heart failure. Acute heart failure secondary to hypertensive crisis. Acute heart failure secondary to the hypertensive crisis, and immediately you have to control the blood pressure by giving intravenous nitroglycerin. Right? Question number 46. Okay. I am deliberately not discussing too much of the theory because exam is very, very close, and the main aim is that you should not do any PYQ wrong. So that's why I'm just telling you important PYQs and some salient points related to that. I hope that's okay. I can go into the detail of the theory, but I don't want to go into this point at this stage. A 50-year-old man with a history of smoking, because smoking diya hua, right, presented with the pain in the right arm and evidence of ptosis, and a chest x-ray shows right upper lobe mass. That's a classical appearance of Pancoast tumor. Classical appearance of Pancoast tumor. And this is why there is a ptosis. There is a ptosis because of the Horner syndrome. Why there is a pain in the right arm? Because of the brachial plexus involvement. Who will tell me what is a preferred investigation in a patient with Pancoast syndrome? Preferred investigation in a patient with Pancoast syndrome. Your answer is MRI. MRI is the preferred investigation in a patient with Pancoast syndrome. Okay, anybody who can tell me golden S sign is seen in? Golden S sign is a feature of. Golden S sign is seen in right upper lobe collapse secondary to bronchogenic cancer. Right upper lobe collapse secondary to a bronchogenic cancer. Okay. 47. A 35-year-old patient presented with cough and fever for the last 2 days. There are crepes on the right side of the chest. X-ray is done. What is the diagnosis? I can see the consolidation in this part that is obscuring the right heart border. What is the sign that we are talking of here? Silhouette sign. Right? Silhouette sign. If there is an obscuration of the right heart border, where is the pathology? Right middle lobe. Right middle lobe. If you get a pathology that is obscuring the left heart border, where is the pathology? Lingula. Then the answer is lingula. So right middle lobe consolidation is the answer for this case. 48. A 60-year-old patient presented with acute onset chest pain. See again same question. His blood pressure in the right arm is 160, left arm 160/86. What is the diagnosis? Acute aortic dissection. Acute aortic dissection. So if you're gonna see questions of radiotherapy are repeating, same question of aortic dissection is coming again and again. So you cannot afford not to know these kind of questions. Identify the investigation. What do we see? What are we seeing? If we are seeing the jejunal loops and ileal loops. If we are seeing the jejunal loops and ileal loop, the name of the investigation is barium meal follow-through. Jejunum has a feathery pattern. Ileum is featureless. Jejunum has a feathery pattern and ileum is featureless. Okay. Question number 50. Where do you find gasless abdomen? In which condition would you like or will you find gasless abdomen out of these four? Gasless abdomen means when you do an X-ray abdomen, you do not see any gas in the abdomen. Now this happens in patient with acute pancreatitis. Because of the very severe vomiting, all the air comes out and virtually it left with no gas in the abdomen. In severe intestinal obstruction also, you can see gasless abdomen when the entire bowel loops are filled with fluid and there is no gas at all. 51. A patient presented with neck swelling and regurgitation and frequent aspiration. There is gurgling sound when pressed in the neck region. A barium swallow was performed. Gurgling sound, neck swelling, regurgitation, halitosis, bad breath. It is giving you, there is a contrast filled out pouching which is called as pharyngeal pouch or Zenker's diverticulum. Pharyngeal pouch or Zenker's diverticulum. Another image of the barium. Image of the barium is also a standard part of the paper. Almost every year you're gonna see one question on the barium study. What is the most likely diagnosis of the following barium image? You can see a marked narrowing of the esophagus with irregularity and proximal shouldering. It leaves no scope for the confusion. It is carcinoma esophagus. Okay. Achalasia cardia will show a bird beak appearance. Bird beak appearance. Okay. 53. A patient presented with blood in stool and mass palpable on the examination. Barium study was performed and shown below. What do we see? What are we seeing? What is this called as? This is called as coiled spring appearance. Coiled spring appearance. And coiled spring appearance is a feature of intussusception. Intussusception. Okay. Now see, NEET PG 2020, this was asked. NEET PG 2022, this was asked. So the question was same, the image was different. Now that was ileal intussusception. This was ileocolic intussusception. This is an ileocolic intussusception when there is a telescoping of one segment of bowel into another segment and what is called as claw sign. Claw sign, which is a feature of intussusception. Okay, intussusception again. See, same question is repeated again and again. So please make sure that you know these answers. Question number 55. A CT scan of the 53-year-old patient is given who presented with abdominal pain. Which of the following statement is correct? First, let's see what do we see in a CT scan. We are seeing hypodense lesion in the liver with crumpled membrane within. And that's a classical appearance of hydatid cyst. A very, very classical appearance of the hydatid cyst. Now, surgery is mandatory. No, that is wrong. Pair, puncture, aspiration, injection of a sphericidal agent, re-aspiration is the preferred treatment. Etiology is echinococcus species. That is correct. Angioembolization is indicated. No, this is not a vascular lesion. FNAC is contraindicated. Answer is etiology is echinococcus species. Right? Question number 56. A 40-year-old patient came in emergency department with abdominal colic and feature of obstructive jaundice. Her counts and liver enzymes were elevated. A USG was done and the gallbladder was scleroatrophic and CBD was impacted with stone along with IHBR dilatation. That means they have tried to tell you that there is a choledocholithiasis. What is the next step in the management of the patient? Answer is ERCP, MRCP. First, identify the exact locations of the stone on MRCP and then do an ERCP to take out these stones. So that is why this is the best answer out of these options. NEET PG 2022. I have tried to recall almost the exact language of the question, the way that it was there in the paper. All right. These kind of questions are characteristically image-based question. When you have a classical image, what is the name of this sign that has been shown to you? Beaded pattern. And this is called as beaded pattern, and beaded pattern is a feature of primary sclerosing cholangitis. Primary sclerosing cholangitis. Anybody who can tell me what is the name of the sign seen in Caroli's disease? Name of the sign on imaging seen in Caroli's disease. What is the name of the sign? Yes. Central dot sign. Central dot sign. Anybody who can tell me double duct sign is seen in? Double duct sign is seen in. Double duct sign is seen in if the patient has got waxing and waning pattern of jaundice. If the patient has got waxing and waning pattern of jaundice, then it is seen in periampullary cancer. However, if it is presented with gradually progressive jaundice, then the answer is carcinoma head of pancreas. Then answer is carcinoma head of pancreas. Okay. 58. In the given radiograph, the dilated bowel loops, which is the marked arrow represent. What do we see? This is what is a feathery pattern. See again, at one place they show a feathery pattern and others show a feathery pattern and they ask you what is the name of the investigation. So this is jejunal loop. This is jejunal loop. Feathery pattern. When you see this, this is a case of, or this is a jejunum, right? Another same question. See, patient presented with distended abdomen and pain in the abdomen for 4 days. Radiograph. What is the most likely diagnosis? What do we see? Again, here under right dome of diaphragm, hollow viscous perforation. Here under right dome of diaphragm, hollow viscous perforation. Alright. Very, very commonly asked. Pneumoperitoneum, pneumothorax, EDH, SDH, SAH, diffuse axonal injury, and these are the questions that are shape of skull, shape of heart. These are the questions that have to be there and you have to know them without a doubt. A patient met with a road traffic accident. In the casualty, he has a feeble pulse with pulse rate of 110. There is reduced air entry on the left side of the thorax. Systolic BP is 70. There is bruising in the left hypochondrium with ecchymosis. Examiner has given you the history of an RTA with unstable patient. Please remember, if a patient is unstable after an RTA, your aim is to treat without wasting time. And the only investigation that can be done in these cases are the ones that are not wasting your time. And what is that? And that is fast. Focus assessment by sonography in trauma. And nowadays it is not fast. Nowadays it is e-fast. E-fast. Okay. Who will tell me which hematoma cannot be seen on e-fast? Which hematoma cannot be seen on e-fast? What is your answer? Answer is retroperitoneal hematoma. Retroperitoneal hematoma will not be seen on fast because retroperitoneum is not very well seen on fast. If the patient would have been stable, then my preferred investigation would have been CECT in this case. Then the preferred investigation would have been CECT, right? 61. A 35-year-old female with a dull aching pain for the last 1 year. On examination, she has sterile pyuria. अरे sterile pyuria है. Sterile pyuria किसमें होता है? Renal TB में होता है, right? Renal TB. And what do you see? Now you are seeing calcifications. If it is white, it is either bone or stone. If it is in the lumen, calculus. If it is in the tissue, calcification. Answer is putty kidney. Answer is putty kidney. Right? Okay. Now see, same question was asked in 2021 again. Please see, this was asked in 2023 and this was asked in 2021. A 35-year-old with dull aching pain in the back and sterile pyuria. Radiograph is given. Diagnosis. Answer is putty kidney. Answer is putty kidney. तो देखो 21 में ये आया, I remember. 23 में ये आया. तो देखो 22 में I remember. 22 में ये आया. This was asked in 22. NEET PG 2022. A delayed intravenous urogram of the patient is shown. What is the most likely diagnosis? Yes, anybody? What is the diagnosis? Okay. Now, this looks like a staghorn calculus, but please remember this is an intravenous urogram. And if it's a contrast study, always remember, if it's a contrast study, you cannot see a stone. You cannot see a stone. That means this is a dye. This is not a stone. This is a dye. And if this is a dye, this dye is present in pelvis. If it is present in the pelvis, it should have gone into the ureter. And since it is not able to go into the ureter, that means there is a block here, and that is why what is the answer? Answer is pelvic-ureteric junction obstruction. Pelvic-ureteric junction obstruction. Those who have just memorized it, they did it wrong in the paper. But those who have attended the class well, they knew that calculi and calcifications are best seen on a plain X-ray. If it's an IVP, if it's a contrast study, this much white should be dye. And this is what you have to remember in the future exam also, right? Okay. Now let us see this. Yes, this. Find below the contrast study and identify the investigation and possible diagnosis. So please remember, don't miss it here. If you are seeing complete bladder and complete urethra, it is MCU. Okay. If you are seeing only the anterior part of the urethra and the dye has been given by putting a cannula or a catheter at the penile tip, this will be RGU. This will be RGU. RGU will be to see the anterior urethra. RGU will be to see the anterior urethra and MCU will be to see the bladder and the entire urethra. Okay. And what do we see? Now in this case, we are seeing the dye has been placed over here because this part is better seen. So this is an anterior urethra. So this is an RGU and I can see a narrowing in the distal part of the penile urethra. So this is RGU with penile stricture. RGU with a penile stricture, right? Again, now let us see this. A 6-year-old child presented with recurrent UTI. Recurrent UTI. Okay, so this is, I have to change slightly for this here. The question says MCU image is given below. This was the NEET PG 22 question. I distinctly remember it. MCU image of the patient is shown. What is the most likely diagnosis? And if the MCU image is given, this is bladder. There is a reflux of the dye in bilateral ureter, and this is a case of vesico-ureteric reflux. This is a case of vesico-ureteric reflux. If an MCU image is given, you should always think about VUR or PUV. And PUV shows keyhole pattern. PUV will show keyhole pattern, and in VUR there is a reflux of the dye into the bilateral ureters. 64. A 30-year-old with motor vehicle accident presented to the casualty. His vitals are stable but is unable to pass urine. He has blood at the urethral meatus. That means there is a urethral injury. There is a urethral injury. An RGU was performed as shown below. What is the most likely diagnosis? So please remember, urethral injury with RTA. RTA is associated with pelvic fracture. This image is not showing the pelvic fracture very well, but in the exam, pelvic fractures were very clearly seen. If the RTA is associated with the pelvic fracture, the part of the urethra that will be injured will always be membranous urethra. However, if it's a straddle injury, bicycle injury, manhole injury, then the part of the urethra injured will be bulbar urethra. Okay. Now in this options, if you're gonna be smart enough, then you could have easily identified the answer. Spongy urethra is the other name for anterior urethra, which include bulbar plus penile urethra. Okay, so if bulbar urethra is the answer, spongy urethra will automatically become the answer. So these two are anyway ruled out as a common choices. Correct? So this is another way to solve the question. 66. A 22-year-old female presented with swelling in the forearm. Swelling is given below. What do we see? Always remember a lytic lesion in the epiphyseal region. A lytic region in the epiphyseal region will be either GCT or chondroblastoma, right? If it is epiphyseal, it cannot be ABC. Remember this. If it is epiphyseal, it cannot be ABC. If there is a fusion of the growth plate, if the growth plate is fused, you are dealing with an adult. And if it's an adult, it is GCT. So this is GCT. If it's an adult, it is GCT. If it's a child, it is chondroblastoma. Simple. If it's a child, chondroblastoma, adult, GCT. Another patient, lytic lesion in radius. Lytic region in radius. So in one exam, they gave it in ulna. In another exam, they gave it in radius. The answer is same. Giant cell tumor again. Answer is same. Giant cell tumor again. Okay. 68. A 35-year-old patient presented with morning stiffness and reduced chest expansion. Chest expansion limited hai. What is the diagnosis on the basis of the history and the radiograph? What do we see? A typical bamboo spine. A typical bamboo spine feature of ankylosing spondylitis. Ankylosing spondylitis. Again, 23. This was asked. Let me show you another one. And I think I don't have the number. Maybe 2021 also this was asked. 2021, 2023 this was asked. So I'm telling you, please remember, few questions will be direct repeat, few questions will be improvised repeat. So you have to make sure that you're not doing any blunder and you're not doing any of them wrong in the paper. What is the most likely diagnosis of this 65-year-old lady with backache and following radiograph of the spine? What do we see? Look at the anterior vertebral line. There is broken. That means there is a slippage of one vertebra over another. What is this called as? Spondylolisthesis. And this is called as spondylolisthesis. And this is a very easy image. What do we see? There is a scoliosis. Which angle do we measure in scoliosis? Cobb's angle. There is a Cobb's angle. Who will tell me Bowler's angle is used for? Bowler's angle is used for. Bowler's angle is used for calcaneal fracture. Calcaneal fracture. Ferguson's angle is also used in scoliosis. And Ferguson's is also used in scoliosis. 71. A 60-year-old female with a chronic backache, radiograph of the lumbar spine was performed. Now what do we see? Now we are seeing a typical, what is this called as? fish mouth appearance. The shape of vertebrae, shape of skull, shape of heart. If you have not revised it, you have to revise it immediately. Immediately after this session, you are revising it. Fish mouth appearance. Fish mouth appearance is a feature of osteoporosis. Osteoporosis. If you're unable to solve majority of these questions and you're feeling a problem, I don't think these are very, very easy questions, and I'm sure that you're prepared pretty well. But if you have not prepared, you can go to my YouTube channel, Dr. Rajat Jain, and there are some 1-minute videos. It's a 1-minute series. If you're gonna go to the playlist, you're gonna find it, and just quickly go through that. There are around 40 1-minute videos, and you can quickly revise the entire radiology in that 40 minutes. That will be very, very useful for you. 72. 10-year child presented with limb pain and normal bone mineralization. Radiograph is shown. What do you see? A classical splaying and fraying. Classical splaying and fraying. What do we see? What do we see? This is rickets. This is rickets. Wait. Sorry. There is a spleen. My fault on this. There is a ring shape epiphysis over here. There is a ring shape epiphysis, and this is not a spleen. This is a sign of scurvy. My fault on this. Sorry for this. So there is a ring shape epiphysis, and this is a ring shape epiphysis, and that's a spur. So this is a appearance of scurvy. My fault on this. 73 we have covered. 74. A 23-year-old female had a history of 2 stillbirth. Ultrasound revealed presence of a uterine. करते बच्चे इस बात को ना अनु इसको let's discuss scurvy and rickets in a second. Ultrasound revealed presence of a uterine anomaly. Which of the following investigation will be most helpful in confirming the abnormality? So please remember, uterine anomaly, if somebody asks you, if laparohysteroscopy is given in the option, this will be the best answer. If laparohysteroscopy is given in the option, then this is the best answer. If laparohysteroscopy is not given, then MRI is the best answer. So since laparohysteroscopy is given in this, I would like to go with the laparohysteroscopy. The problem that happens is when only laparoscopy is given in the choice, or when only hysteroscopy is given in the choice. So if laparoscopy is alone given, then mark MRI. If hysteroscopy is alone given, then mark MRI. But if lapro plus hystero is given, then that will be the best answer. Alright. Images of HSG is another thing that you should know. NEET PG 2020. They asked this. What do we see? Bilateral hydrosalpinx. Bilateral hydrosalpinx. Now in HSG, they can ask very simple question like in 2021, they gave this image and they asked what is the name of the investigation. What is the name of the investigation? So please remember, if you are seeing the uterus, it is HSG. If it's a X-ray background, then it's a conventional HSG. If it's a CT background, then it is CT HSG. If it's an ultrasound based procedure, then it is sonosalpingography. So what is this? This is nothing but the hysterosalpingogram, and a very, very classical image of a hysterosalpingogram. 77 is a controversial question that was asked in the NEET PG 2022 exam, and in NEET PG 2022 only 198 questions were evaluated. 2 questions were not evaluated. I feel that this might be one of the questions that was not evaluated because the explanation it was incompletely or incorrectly framed. So HSG is not the best investigation to differentiate a septate uterus from a bicornuate uterus, but still you should know it. If it is asked, ultimately we have to mark an answer. if the two horns are appearing close to each other and the angle between them is acute, mark it as septate uterus. However, if they are far apart and the angle between them is obtuse, then mark it as a bicornuate uterus, and this will qualify as a septate uterus, and that is how I am gonna do it. 78. An infertile woman undergo treatment for infertility, given HMG, she has abdominal distension and vomiting. Even if you do not know anything, even if you do not know the image, you know it is OHSS. And let's see again. This was asked in 2020 and this was again repeated in 2023. Same question, same image, repeated 20 and 23. So OHSS, OHSS. Alright. Please do not confuse it with the polycystic ovarian disease. In a polycystic ovarian disease, you're gonna see peripheral range follicle, which is called a necklace appearance. Necklace appearance, right? 60. NEET PG 2020. This was another question that was asked. 60-year-old female with history of menorrhagia, postmenopausal bleeding, with ultrasound showing mass in the uterine cavity with feeding vessel sign. So feeding vessel sign was given. Even if you do not know anything about the image, ignore it. Feeding vessel sign is a feature of endometrial polyp. Feeding vessel sign is a feature of endometrial polyp, right? And this is the last question in this NEET PG PYQ series of the radiology. A 7-week pregnant female accidentally exposed to the chest X-ray in the hospital. What is to be done? What you need to remember? Accidental exposure of ionizing radiation of diagnostic range is not an indication of termination of pregnancy. Accidental exposure of ionizing radiation of diagnostic range is not an indication of termination of pregnancy. So what will be your answer? Continue pregnancy. Alright, continue pregnancy, right? Okay guys, so that is all. In this 1 hour and 15 minutes, I have tried to give you a quick overview of the last 5 years of the NEET radiology questions. Do let me know that if anything else that I can do. Please, if you want to follow me, join my YouTube channel and join my Insta. I will share this on my Telegram group, the annotated PDF on my group as well as onto the DBMCI Premier group. So if you want it, please let me know, and let me know now if I can do anything else. Now, before I go or before I finish it, I am very sure that you people have done very well, but I am telling you, please make sure that you are revising these particular topics before you are going for the exam. And these topics are: first, radiation tables. Please do not miss radiation table. Please do not miss uses of nuclear scan. There is a table of uses of nuclear scan. Then please make sure that head trauma you are revising. Please make sure that you are revising stroke. Please make sure you are revising contraindication of MRI. Please make sure you are talking or thinking about or doing little bit about the contrast, specifically about the blood tests that are done before the contrast. Please make sure that you are reading shape of skull very well. Please make sure that you are reading a normal chest X-ray. Please make sure that you are reading about pulmonary embolism. Please make sure that you are reading about aortic dissection. Aortic dissection, images of TB, shape of heart. Then please make sure that you are reading about barium studies. Then abdominal trauma, small bowel obstruction, perforation. Okay, these are the topics that you have to know. You have to know without doubt. Abdominal trauma, small bowel obstruction, perforation, MRCP, ERCP. You have to know MRCP, ERCP. Then you have to make sure that you know about trauma or various fractures. You should know about the imaging of bone tumors. Okay, bone tumor. Then you should know X-rays of the bone. Which carpal bone is where? What are the distal end of the humerus? And then you should know which is ACL, which is PCL. on MRI of the knee joint. Okay. Then you should know stones in kidney. Stones in the kidney. Then you should know MCU, RGU, IVP. So that's whole syllabus. All these are things. All these things are. But do you know it will not take more than 1 hour to revise them, dear. And not more than 1 hour to revise. Then and it is not just the radiology. You are revising the subjects also along with this, because you are revising MCU, RGU, IVP. You are revising surgery. You are revising ACL, PCL, tumor. You are revising orthopedics. So these are the important topics from which the questions are asked in the paper, right? MCU, RGU, IVP. Then you have to make sure that you know about the HSG images and HSG images. So these are, according to me, are the very standard topics that are asked in the exam. You want to quickly revise them. I have already told you in my YouTube channel, go to 1 minute radiology series. It is 1 minute. है ना, जब भी आप लंच कर रहे हो, लंच करते हुए 3 1 मिनट देख लिए, डिनर कर रहे हो 3 1 मिनट देख लिए, है ना. दैट इज हाउ यू कैन डू दैट. ऑलराइट, चलो. सो अब देखो रिकेट्स और स्कर्वी, मैं भी थोड़ा सा कंफ्यूज हो गया था. तो देखो रिकेट्स में क्या है, रिकेट्स में ये फ्रेइंग दिखेगा, वो फ्रेइंग नहीं दिखा मेरे को जब मैंने देखा ना. तो फ्रेइंग यानी कि ये मेटाफाइसिस है. मेटाफाइसिस विल बी फ्रेड लाइक दिस. ओके. स्प्लेइंग, फ्रेइंग एंड कपिंग. कपिंग कैसी होगी, कपिंग ऐसे होगा, तो वो ऐसा मेटाफाइसिस होगा और ऐसे फ्रे करेगा. तो स्प्लेइंग, फ्रेइंग एंड कपिंग. Splaying, fraying and cupping, these will be the features of rickets. If it's healed rickets, then you will see metaphyseal line. You will see metaphyseal line. Just remember, if the metaphysis is like this with irregularity, it is rickets. Okay. और mineralization normal दिया हुआ था वहां पर, ये भी एक important point था. Categorically it was written that the mineralization is normal. It was stupid of me that I did not pick it up. Now स्कर्वी में क्या मिलेगा, स्कर्वी में सबसे पहले मिलेगा रिंग शेप एपिफाइसिस. That's a very important feature. Ring shape epiphysis. What is this called as? Wimberger's ring. Wimberger's ring. Very important. Subperiosteal hemorrhages can also be seen. Pelkan spur. Pelkan spur. That metaphyseal spur that I thought as a splaying was a Pelkan spur. That means metaphysis का एक spur दिखेगा. That is a Pelkan spur. है ना. Trummerfeld zone. Trummerfeld zone. जो metaphysis है उसके just proximal the area will be slightly osteoporotic. So zone of rarefaction proximal to the metaphysis is a Trummerfeld zone. And yes, obviously white line of Frankel. White line of Frankel can also be seen. Okay. All right. So this is the differences between rickets and scurvy. Chalo. Okay. Chalo. All right, guys. Thank you very much for your time. I hope that I have not wasted your time. Please read to the best of your effort in the last few days. Please make sure that you are quickly revising your forgettable stuff in your notes that you have. Please make sure that you have done a good revision of previous year MCQs of specifically last 5 years of the NEET exam. INI, CT, FMG are optional, but NEET is must for the NEET exam. FMG is must for FMG exam. INI, CT is must for INI, CT exam. Rest exams are optional. So you are very thorough. If it's a direct repeat, you are not doing it wrong. Do not get anxious with this 5 pattern. है ना. आज देखा कैसा पैटर्न दिया है आज एक. I hope you know that the mock test has been released on the website today. है ना. And the kind of questions that they have given in the mock, let us hope that this kind of bouncers are not there. Okay, so don't worry. They have not given the medical field question. They have just given the question just to make you aware about the pattern, not for the questions. Okay, so that is all from my side. Thank you very much for your time. Please let me know if we can do anything else for you. Take care and may God bless you all. Name of my Telegram channel is Rajat's Radiology Review. Rajat's Radiology Review. Or you can send me a link, a request on Insta. I will share the link with this. You can go to my Insta. It's Doc Rajat Jain. And from there, you can go to the my Telegram channel also. All